Hi, everyone. Thank you so much for joining us today for another one of the Alzheimer's Foundation of America's monthly Care Connection webinars. I'm so happy to be here with you all today. My name is Laurel Gumpert, and I'm the Educational Program Coordinator here at AFA. I know that many of you were expecting Dr. Brant Courtright to be here this afternoon. Unfortunately, due to unforeseen circumstances. We just learned only moments ago, unfortunately, that he's unable to give this webinar today. However, that being said, we are still going to have a really exciting, wonderful, meaningful webinar today, so don't worry. So today we're gonna have a great discussion actually with our Director of Education and Social Services, Jennifer Reeder, and we're gonna be talking about navigating family dynamics in dementia care. She is the best at this, so we're still going to have a really wonderful time today. Before we get started, just so y'all know, all lines are currently muted, but we do encourage questions throughout this. We're going to have time for a brief Q&A at the end. So please utilize that question box on the right-hand side of your screen. And without further ado, I'm going to pass it on to Jennifer Reeder. Thank you.
Thank you all so much for being here today, and I'm so sorry that you weren't able to see the program that you were hoping for. But when we immediately realized that we weren't going to be able to have our speaker today, I thought about what kind of information might be helpful for everyone today. And being that I have an extensive history of providing family therapy and being certified in ecosystemic structural family therapy, I thought it might be really helpful to provide a presentation for you all about navigating family dynamics in dementia care. So this is what I'm going to do for all of you. I'm going to first talk a little bit about Alzheimer's disease, and then talk about the impact of caregiving, and then get into what it looks like for families when someone in the family has dementia. Because I think it's important to first kind of give you all that foundation of what Alzheimer's disease is, what the impact of caregiving is, so that we can then move into how family members can really support one another. Because as we know, families are incredibly complicated in of itself. But then when someone in the family has dementia and everyone has to start working as a team, that can be incredibly difficult and so much easier said than done, because there's so much history, rich history, hurt history, anything and everything that happens in families. So as Laurel was saying, at the end of this presentation, I'll have time to be able to answer any questions that you might have. And I'm really also excited to share with you how to be able to hold a family meeting. So without further ado, I will begin. So I first want to start off. So Alzheimer's disease. Alzheimer's disease is a brain disorder that impacts memory, thinking, and language skills, and the ability to carry out the simplest of tasks. So it is the most common form of dementia. About 60 to 80% of dementia cases is Alzheimer's disease. Now there are many other types of dementia and illnesses related to dementia, such as vascular dementia, frontotemporal dementia, dementia with Lewy bodies. But I think Alzheimer's disease tends to get a lot of attention because it is the most common type. Now, Alzheimer's disease is chronic, progressive, and a degenerative disorder. So this means that someone can live with the disease for a very long period of time, sometimes over 10 years. And unfortunately, the disease just continues to progress. And because it's degenerative, that means that an individual's functionings will continue to deteriorate. Now, there are two types. So there's young onset and late onset. Young onset is also considered early onset, which means that someone will develop symptoms earlier than the age of 65. Young onset is pretty uncommon. Only about 4 to 6% of cases of Alzheimer's disease is young onset or early onset. And learning more and more about how it can also be connected to substance misuse as well. So there are different reasons on how somebody or why somebody may develop Alzheimer's disease. And at this point, it's estimated that about 6 million people in the United States have Alzheimer's disease, and this number is going to triple by the year 2050. And a lot of that is because people are living longer, and the highest risk factor for Alzheimer's disease is age. And also, I think it's important to note too that Alzheimer's disease is the sixth leading cause of death in the United States. And individuals will typically first experience memory loss because a lot of the times Alzheimer's disease first affects the hippocampus, which is responsible for memory and learning skills. So now looking at the progression of the disease, and I really want to put this in the frame of thinking about, not only the individual, but what's happening for the caregiver, the care partner, the family member. So in the early stages of Alzheimer's disease, an individual will experience problems with complex mental tasks, confusion or disorientation in familiar places, difficulty learning new tasks or remembering new people, as well as mild language challenges. So, as you can imagine, this is incredibly stressful and frustrating for the individual. So, but yet, a person can still be very independent during the early stages of Alzheimer's disease. So I think in the early stages, for the caregiver who's probably not even taking on a role as a caregiver, more so partnering with the individual. I think that's when it's really appropriate to use the term care partner, because you're partnering with how the individual wants their future to look. And this is why I think it's helpful for people to get that early diagnosis, because then they can be a part of their future planning. They can plan for what they want their finances to look like, where they want to live, what they want their healthcare to look like, all of that. So, in the early stages for the family member who's taking on the role of caregiver someday, they're really just helping the individual navigate in what they want their life to look like in the future. And then in the middle stages, this is when an individual will experience disturbances in sleep-wake cycle, hallucinations and delusions, as well as difficulty executing personal care independently. So this is when the care partner, the family member, will start to take on tasks that may look like caregiving, because they are helping their loved one with their personal care. And this is when things can start to get very stressful, because the individual with the disease, not only are they going to need support through personal care, but this is when somebody can start to experience personality changes and behavior changes and experience those hallucinations and delusions. So it can be really stressful on not only the individual, but also the family member, because they're starting to see how the disease is affecting their loved one and how it's slowly taking their loved one away from them. So, this is a time, I think, when it's really important for the family member to start seeking their own support. Because I think a lot of people at this time are thinking like, I can do this on my own. I've been doing this on my own. But in reality, the individual, the loved one, is going to need them more and more and more as the disease progresses. So this is the stage when it's really important for the family member to start reaching out to other family members, to their community, whoever it is that they see as a support, because you can't do it on your own. And people who do it on their own know that it is so difficult. So, and then in the late stages, there's severe language and motor impairment requiring complete assistance with personal care and widespread disconnect from the environment and people and oneself. So this is where we are reserving the individual's quality of life and their dignity. This is where we are continuing to treat the individual like an accomplished adult, because no matter how far the disease has progressed, we always have to remember that the individual is an accomplished adult, and we always need to show them that respect and that dignity. So, and this is where I think it's important too for family members and the caregiver to continue to seek different ways to maintain that connection with their loved one. And sometimes I always like to think of it as like the five senses. So thinking about the five senses and how you can connect with the person, because at this point, they're not going to be able to communicate verbally. So you can connect with them through, even if the person's unable to eat like the food of their culture, just being able to smell the aromas of the food can help them feel like they're in a happier place. any kind of fabrics that they might really enjoy, helping them, with different blankets or clothing, being very conscious of the fact that the person's going to have very sensitive skin, thinking about things that they love to see, whether it's photographs or movies or music is always incredibly helpful for somebody who has Alzheimer's disease. So this is just, I'm showing you, what the progression of not only the individual is going through, but also what is needed from the family caregiver as well. So now, I just want to share like some more information just about caregiving, because I think it's really important to highlight this. So more than 11.2 million Americans provide unpaid care for people with Alzheimer's disease and other dementia-related illnesses. And in 2020, caregivers of those with dementia provided 15.3 billion hours of unpaid care, which equates to $256.7 billion. That's unpaid funds. And to try to put it in like a global perspective, so globally, the societal cost of dementia is $818 billion, and that's globally. So we're only talking about in the United States, where individuals who are taking on the role as caregiver, how much they are working to support their loved one. And this is why there can be that financial burden. But there are three primary reasons why somebody is going to become a caregiver. So to keep their loved one at home, close proximity, sometimes obligation. Different cultures view what caregiving is going to look like. Sometimes it's a requirement. This is what happens. You take care of your family. You take care of your elders. And then in other families, we are going to seek a healthcare provider to do all of that type of thing. So I think it's interesting to note too that 2/3 of dementia caregivers are actually women. But then also thinking about what the impact of caregiving is. So this is what I think is really important to know, is that although 45% of dementia caregivers feel what they're doing is rewarding, twice as many from non-dementia caregivers experience extreme emotional, financial, and physical challenges. And I think so much of that is because of the personality and behavior changes that's happening for the individual with the disease. When we think about if we're caring for a loved one who has a disease such as cancer, the individual knows that you are caring for them because that's what they need. Somebody with Alzheimer's disease, as the disease is progressing, it can become more difficult for them to even recognize their own symptoms. So, this is where it can be very tricky for the caregiver, because they're trying to support their loved one, but the individual with the disease may not even recognize that they need that support. So it can be extremely emotionally challenging in addition to the physical and the financial challenges. And 41% provide caregiving alone. I feel like that's a really high number, which is why we're going to talk about families. Because I think, so many people think they have to do it on their own. But it doesn't have to be that way if there are people who can provide that support. And during the late stages of Alzheimer's, 59% of caregivers feel they are on duty 24 hours a day. And I think this contributes to the 72% reporting a sense of relief after the passing of their loved one, because there's such a thing as anticipatory grief. You're anticipating for the loss of someone. And because Alzheimer's disease is chronic and progressive, over the course of years, as I said, sometimes over 10 years, you are seeing your loved one being taken away from the disease during that entire time. So by the time they have passed, there is going to be that sense of relief, not only for them, but for yourself as well. We are all human beings, and we are trying to do the best that we possibly can. But so, this is where we want to think about who's in the family. Because if somebody does have a supportive family, somebody does have family members, there are people that can help. So, if we are working with a family, or we are the family, thinking about, what does family mean to my loved one? What does family mean to the person? It's not always going to be a blood relative. Sometimes it's going to be the person's community. Sometimes it's going to be their neighbors. Here in Brooklyn, or in New York, I live in Brooklyn. There are so many people, older people who have lived in their building for decades, sometimes since their 30s, maybe even earlier than that. Maybe they even grew up in that building. So, their neighbors could be their family. So I think it's good to really think about, who does the individual see as their family, and working from there. And so, and then we also have to acknowledge, though, that it is important to note that not only the individual shows changes as the disease progresses, the family system can also go through a variety of changes as the disease evolves. As I said before, families are complicated. There is a lot of love, there is a lot of hurt, and all of that boils up, sibling rivalry. I know even with my own siblings, I think that the rivalry is gone, but then as soon as we're together, who's getting more attention from mom, who's getting more attention from dad, it all just kind of boils back up again. So, we have to be very conscious of what the dynamics are of our family to then be able to figure out how to work with them. But so I thought it'd be kind of interesting to share with all of you just what some family roles look like, because families are organized around roles, rules, rituals, and boundaries. And so this structure assists in the understanding of the family and the function of its members. So, thinking about, and I'd be interested to hear from all of you at the end, if you can relate with any of these family roles. So, so there's the hero. The hero is the good and responsible child or person in the family. This person is a high achiever, carries the pride of the family, and they overcompensate to avoid looking or feeling inadequate. So it's that person who's always trying to do their best, always trying to look like they're their best, because they don't ever want to look like they're inadequate in any way. Sometimes they could be a know-it-all, maybe. There's the rescuer. So the rescuer takes care of others' needs and emotions and problem solves for others in the family. The rescuer might have difficulty with conflict. They take on the role of rescuer in the name of helping others, though it is often to meet their own needs, such as relieving anxiety, often sometimes an enabler. So, being a family therapist for so long, when I would work with a family and an argument would come up, I would never try to step in the way and make it go away, because sometimes arguing brings things out, and then you can actually realize and recognize what it is that needs to be worked on. But for people who are anxious around arguing, they might try to dissipate it as soon as quickly, make it go away as soon as possible. But that can enable behaviors at the same time. There's the power broker. This person works at maintaining a hierarchy in the family, with them on top. Their safety and security with life depends on feeling in control of the environment around them. So this is the one that always needs to be in control. These are the ones that likes to be a decision maker, because then they know, they have a better idea of what the outcome is going to be if it's their decision on what's going to happen. There is the scapegoat. This is the person in the other family members. This is the person the other family members feels that needs the help. Usually this family member is in need of treatment or has been in treatment. This person often shows the obvious symptoms of the family being unable to work through problems. So the scapegoat is kind of showing what the negative symptoms are of them, what's happening for the family. And I'm sure people can relate. I know I was a scapegoat for a long time when I was a kid. And sometimes it's the teenager. When I was doing family therapy, working with children and families for a while at one point, many years ago, a lot of the times the parents would say, fix my child, just go fix them. But, I had to help them see that it's a system. A system is involved here. So everybody participates in that system. So if something needs to change, everybody needs to be a part of that change. There's the lost child. The lost child is a subservient good child. They're obedient, passive, and hidden in the family trauma, if there's family trauma. And they stay hidden to avoid being a problem. So, this is the kid or the individual who's going to jet. As soon as something comes up, they're going to go. This might be the adult child who is in California when the rest of the family might be in Pennsylvania or New York, because they just had to get away because they couldn't take it anymore. And there's the clown. The clown uses humor to offset the family conflict and to create a sense that things are okay. This person has a talent to readily lighten the moment, but they hide their true feelings. So, this is the person who thinks that humor is going to make everything better. It's going to make the conflict go away too. But yet again, sometimes conflict is necessary to really see what the core issues are for the family. And so I just wanted to share with you all some, common changes that may affect family dynamics. So having all of this in mind about, all these different family roles that go on, everybody plays a family role. But, when somebody has dementia in the home and somebody has an illness in the home, a disease, this is going to shift those roles. Shifts are going to change. Not everybody is going to be able to stick in the role that they were always in. So roles can reverse sometimes. So somebody who has always been cared for by their mother, even when they were in their 40s, their 50s, they go to their house and their mom still does their laundry, still cooks for them. If their mother then has dementia, as the disease is progressing, they're going to have to start caring for their mother. And there can be a sense of grief as well as in shedding that role that you've always held on to. So not only can there be, I think, grief in what's happening for the individual, but grief in what's happening for the family as well. And there can be increased guilt too. Nobody really knowing if they're doing a good enough job. People can feel like, I think I can do this. I don't know if I can do this. And, that increase in guilt, that's when I think if the family can work as a team, people can talk about what their experience is and trying to hide that guilt that they're feeling. And there can be a shift in priorities. Somebody who may have chosen to never get married, never have kids because they never wanted to take care of anybody except for themselves, those priorities are going to shift. They're going to have to start caring for their loved one, or if there are children involved, the kids are going to have to learn that the attention isn't always going to be on them anymore. Their parents are going to have to care for their grandparents. There can be changes in emotions too. Everybody's going to have a different experience of what's going on. One person may feel that they're the only ones living in New York with their mother. They're the only ones who are going to be caring for their mother. They're the only ones who are going to be making the decisions. But then other adult siblings who live in other states may feel like they're not being included enough, that they're not being given enough information. So they don't know how to help. So everybody's going to have different perspectives and different emotions in what's happening. There's going to be a growth in uncertainty. So, people are going to start questioning, can my brother do this? Can my sister do this? Can I do this? And then, disagreements are going to increase if families really didn't know how to be able to manage that conflict, how to manage disagreements. So, this is where families are going to have to learn, like, okay, this is how we argue. Now, how can we problem solve together? So now I'm going to get into, how to hold and organize a family meeting. And I think, that this learning how to do this can be really helpful, because this is how families can learn to talk with one another and feel that it's a safe space to be able to talk with one another. And I just want to preface, when we're talking about family meetings, it's not about bringing up the past. It's not about bringing up what happened when you were 10 years old and what your sister did and what your dad did. This is about the here and now. How here and now are we going to work as a team for our loved one? So, why are family meetings important for those living with dementia? Well, families are a vital part of the caregiving and support structure for someone living with Alzheimer's disease and other related dementia illnesses. So it's really, really important for family members to be on the same page. Now you want to prepare for the meeting. So first and foremost, if your loved one is able, ensure they're involved in all preparations. So, this is about the person with the disease. This is about the person. So that means the person needs to be involved in all of it. I think for so many people who develop dementia, who develop Alzheimer's disease, a huge fear is that their independence is going to be taken away, not just by the disease, but also by the people around them, that people are going to start to try to take over. So we never want an individual to feel like we're participating in their fear of their independence being taken away. So this is why we always need to include the individual in any type of plans that we create, any type of plans that we make. So, we want to set realistic and attainable goals, and a part of that is developing an agenda. So I think a good thing is to set a start time and an end time, because sometimes, meetings can just continue on and continue on, and all of a sudden the productivity of that meeting starts to go away and it starts to be less productive. So that's why it's good to have an end time for a family meeting. If you want it to be 1 hour, if you want it to be 2 hours, just, depending on what everybody agrees on. You want to send out the agenda beforehand. So before that, you want to encourage everyone to add something and contribute to the agenda. What do they also want on the agenda? So first and foremost, it's going to be about what the individual who the meeting is for, what they want to be on the agenda, and then, including what other people want as well, as long as it's relevant to the goal, which is to support your loved one. And then also, you want to be prepared with relevant information. So any kind of like doctor's notes, legal documents, any type of resources as well that you think might be helpful. You want to think about who's attending. So, who does the person want to be attending the family meeting? Is there somebody in their life they view as family, and they want them to be at the meeting? I think that's a good idea to do that because it's their meeting, right? It's what they want for them in that meeting. And then you want to assign roles. So you want to think about, who's going to organize this meeting. You want to think about who's going to facilitate the meeting, because there really should be somebody kind of leading the meeting and making sure that it's staying on track when you're going to each item on the agenda. And sometimes some families might want a facilitator who's completely separate from the family, whether that is somebody from a church, whether that's a social worker. It can be helpful, I think, in the beginning stages when you're first doing these family meetings, to have somebody completely objective of the family to be the facilitator, because it can show families how to do it. But I think it's great when families get to a point when they're able to continue to do all of this on their own. You also want to think about, who's going to be the note taker, who's going to be taking notes during this meeting, and then the timer. So who's going to be continuing to, assess what time it is, making sure that all the items on the agenda are being met so that everybody feels like they're being heard and that their item on their agenda is being addressed as well. And so then at the start of the meeting, you want to set a culture of respect and acceptance. So, everybody coming up with, what they want their rules or whatever you might want to call it, what you all want to agree to, what the structure and what the climate of the family meeting is going to be. But you always want to set culture of respect and acceptance. You want to give everyone an opportunity to share positive thoughts and observations and observe the strengths of the family. So that's where I think it's really great for everybody to have an opportunity to share, why they're at the family meeting and something really positive about the family. As well as their loved one too. But I think it's good to really highlight, okay, what are our strengths as a family? And so you can kind of work with that. It's something that you can always go back to during the meeting as well. If your loved one is unable to attend, acknowledge they are the reason you are meeting as a family. Acknowledge the person. Review the agenda and the expected end time, and then also highlight everyone's role too. So, okay, so you're going to be the facilitator this time, you're going to be the note taker this time, just so that everybody is clear as to who's going to be doing what. Also, I think too, it's good to really think about too. I think something else that you want to add too is about like that one person should talk at a time. I think that's a really good one. Avoiding negative comments and judgments as well. And then also, I think it's important too to note that this may become very emotional. This is the time when some people may have, this might be the first time that they're able to talk about what's happening for them, and what they feel like is happening for the family. So it might get emotional. And so I think it's good to agree that breaks are okay as long as we come back. So if somebody needs to take a break because they're feeling overwhelmed, that is okay. Let's take a 10-minute break, but let's make sure that we come back. So, beginning. So giving everyone that opportunity to share those positive thoughts, observing strengths of the family. And as I said before, if your loved one is unable to attend, sorry, so this is the same, this is the same slide as I had before. But yeah, so we just want to continue to make sure that we are highlighting all of the good stuff. So, because as I said, there are going to be some negative things that might come out. So then once we started having the meeting, this is where we're going to create an action plan. I absolutely love action plans to address all concerns. So this is when we are identifying the tasks that need to be completed to address the concern. We're going to assign who is responsible for each task and when each task needs to be completed. So for example, let's say Mr. Jones, he's ambivalent, but he's kind of getting to a contemplative stage of, maybe it's about time for me to move to an assisted living residence. Maybe that's something good for me. But he doesn't know where to start. So this is the reason for the family meeting. And when it comes out and he's sharing with everybody that I'm okay with going to I think I'm okay with going to assisted living as long as it's in this area where we live now. It has outside activities for me to do because I don't want to stop doing that. People can think too, like, okay, so I also want there to be appliances, brand new appliances in the apartment where I'm going to be moving into. So, these are all of the things that he wants to be able to get to a place where he's okay with moving to an assisted residence. And so for the adult children, let's say it's all of his adult children in the family meeting. So Judy is going to check on, what kind of assisted living residences are in the area. Mark is going to, see like, okay, so if they don't have outside activities, are there any close by that dad could get into? And then let's say, Mr. Jones is like, you know what? Also, I don't really like my doctor. I want a different doctor. So George, I don't know if I already said George, but the other child is going to say, okay, I will check out, what doctors are in the area so that you can choose who you want to continue to see. So with all of those tasks, so those are the tasks on the action plan. And then next to each action plan, next to each task, there's going to be a date when Judy needs to get this done, when Mark needs to get this done, when George needs to get this done. And then, there's going to be talk about, okay, so once we've got all of this situated, when are we going to have our next meeting? So, preparing for the next meeting. So you want to agree on a date and time for the next family care meeting. And you can call it whatever you want. You can call it a family care meeting, you can call it a family meeting, you can call it a gathering, whatever you all choose to do. But it's good to have that agreed on date. And this is what's really great about the action plan too, is that you can always, like the next meeting, you got your action plan, you see what you all talked about at first, like the first meeting, and then you can review, like how everything went, what was met, what wasn't met. And then you're going to assign roles for the next meeting. I think it's really great to switch it up on what the roles of the meeting, like for each person, is going to be. And then that might look different, because being the organizer can take a lot of work. So we don't want to put more work on one person than another. We want to share the tasks. And then we want to end the meeting with an opportunity for everyone to share their experiences of the meeting and what they plan to contribute to next time. I think that's good, because some people may have felt that during this first meeting, they weren't able to contribute much because they're not experts on what was talked about. But they really would like to do this next during the next family meeting. So it's just good to have an idea as to what everybody wants to bring to the table to be able to support the person in the family. So then after the meeting, the note taker is then going to email everyone the action plan and any other summaries of decisions and agreements. I think that's really good to do, so that everybody has a reference for what they all came up with. And I think it's also a way to be able to show, like, hey, we did this, we did it. We actually got through a meeting together and we achieved something. We actually created an action plan. We did it. And then utilize a family calendar, which includes medical appointments, activities, and also important deadlines too. So, that could be like a Google shared calendar. Some people aren't good with technology. So, you kind of work it out as to like how you can have this shared family calendar. So then everybody's up to date with what medical appointments are coming up, when the next family care meeting is, and other things that's important for everybody to know about. But I want to highlight some of these too. So important reminders, not everything will be solved at once. That's why it's good to have multiple family meetings, so there's not pressure on this one meeting that we have to get to everything. So, it is step by step by step, and it really depends on the family and how the family is able to communicate with one another. So, just sitting with that and being content with that. Not everything will be solved at once. You are all in the same team with the same goals to keep your loved ones safe and well. So just always remembering that, this is for the well-being of our loved one. This is the well-being. This is what we're doing to make things better for our person. We want to end the meeting on a positive note as best as possible. And I think this is why it can be really helpful to have a facilitator who's outside the family to first do these with the family, so that you can ensure that all of these things are happening. And it's a lot easier to do that when you're objective than when you're in the family meeting and emotions start to come out. And then you want to give everyone a chance to be assigned a role for the meeting. So as I said, you want to kind of share the responsibilities so that everyone feels that they're contributing in different ways. And, I just wanted to share some information for all of you. I didn't know if it might be helpful, but just some tips on how to be a care partner from afar, because a lot of what's going to be coming out of these family meetings sometimes is going to be, okay, so dad lives by himself right now. George only lives about 5 minutes away, but he's out of town a lot. And so dad's at home a lot of the time. So how can we all, even though we don't live close by, how can we all be a care partner from afar? So part of that is getting organized, collect and coordinating all medical information, insurance claims, legal documents. It's really great to be organized. And it can help everybody kind of feel like, all right, at least we know that we've got all the documents in place for if anything were to happen, anything comes up. We want to continuously assess our loved ones' needs. So that's where it's really good to have a baseline. What does dad's home look like? Is it super organized? Because if it starts to look like it's in disarray, then we know that there may be some decline happening. Is there always food in the fridge? And if there starts to be like a lack of food, or food starts to spoil, we know that there's a decline happening there. Is the house always clean as well? So just looking at how everything functions in the person's home and always going back and being able to revisit that so you can see if there is any decline going on. Regularly checking in, however you can do that, regularly checking in, whether it's FaceTiming, whether it's phone, whatever it may be, just to be sure that you are doing those check-ins. Being in the medical care loop, so being sure that those release of information forms are signed so that any kind of information that the doctor may be sharing with your loved one, that is also being shared with you as well. And that if you have to reach out, that you can talk with the doctor. Utilize technology to stay in touch. You can do all different ways with utilizing technology. You can send each other videos, photographs, whatever it may be, to be able to maintain that connection. And we always want to enjoy our time together too. So when you're going to, your loved one's home, you don't just want to be there to get the tasks done. You don't want to be there just to get the grocery shopping done. Take some time to connect and just be with one another. Look at some old photographs, watch an old movie, drink some tea, whatever it may be that brings some joy and connection between you and your loved one. I think that's so important to remember that, because we can get so bogged down with making sure that everything is in place and everything is getting done. But just enjoy your time together. And we have this home safety checklist, and you can always reach out to our helpline. So I don't know if you are all aware, but we have a nationwide helpline. It's staffed by all licensed social workers who are thoroughly trained in dementia care. And so they're there to answer any questions that you may have. If you have questions about how to hold a family meeting, you can reach out to our helpline. But I think this is a really great resource, and we have many, many, many other resources as well that we can provide to you. But this is just an example, to have a home safety check. So if you are supporting your loved one from afar and you go and visit, just making sure that, everything is checked off here. Because there's a lot going on here that you may not even think about, that is a part of home safety. So yeah, please do reach out if you want a copy of this home safety checklist. And then these are just all of our resources and the supports that we provide. So as I mentioned, we have our national toll-free helpline. It's open 7 days a week, 9 a.m. to 9 p.m. So as I said, all licensed social workers, thoroughly trained in dementia care. So please do reach out. We're here to talk with you. So you would just use the bottom, what you can see at the bottom of the slide there, 866-232-8484, to reach out to our licensed social workers. And we have our Teal Room, which provides free activities and therapeutic programs on our website. So it's all pre-recorded therapeutic programs. We have music therapists, creative arts therapists, educators, artists, all providing different programs. And we will soon be opening our doors to the community as well. We are we are located in New York City, Manhattan. We have our Educating America tour, which is incredible. We always have amazing speakers on our Educating America tour, and we stop at, all states in the United States. We have our national memory screening program, so you can always call or go to our website to do a memory screening. I think memory screenings are really helpful. I think it's a great way to kind of assess how your memory is doing every year. We have our Care Connections monthly webinar as today. Again, so sorry that we weren't able to have the speaker that we were hoping for. But I'm hoping that you all are getting something out of this presentation. And we also have our support groups and our Alzheimer's Today magazine too. So we got lots of stuff that we would love to share with all of you. So please reach out whenever you want. And this is my information, so you can always reach out to me directly as well. That is my email address. And now's the time to see if anybody has any questions.
Absolutely. Well, first off, thank you so much, Jennifer. You did an incredible job. I told y'all that if we're talking family dynamics, this is the person that we're going to want to talk to. So thank you so much for that. And I do hope that you all took a lot out of that. If you have any questions, now would be the time to utilize that question box. and ask our wonderful speaker any questions of anything you may encounter. One question that we have, if you have a sibling perhaps who lives somewhere else, lives far away, what's a good way, what are some recommendations for someone who may want to help?
Gotcha. So are you thinking, I'm assuming that this person may live closer to their loved one who may have dementia, and then their sibling lives far away. And this happens often. This happens so often, where one sibling lives close by and the other one does not. But I think this is where, sorry, were you going to say something else, Laurel?
No.
Okay. But so this is where I think it's really, really good to have these family meetings, even if it's just a pre-discussion with your sibling, just to let them know what's happening, what's happening for your parent, what kind of tasks you've had to start taking on to be able to support your parent. So then the two of you can strategize on what your sibling can do to be able to contribute to making sure that all of these tasks get done. Because even though they live far away, there may be certain things that they can do from afar. And as I showed you with like how to be a care partner from afar, those are different ways that they can do that. And sometimes what we do recommend too is, like, let's say that you are living with your loved one who has dementia, and sometimes the evening time can be really difficult for people with dementia. They can experience sundowning. So sundowning occurs a lot of time when the sun starts to go down, because the disease is kind of messing up with somebody's biological clock. And so it can be really hard for caregivers at that time, because they may be exhausted from the day, and then their loved one starts to have more intense symptoms. Sundowning can cause agitation, confusion, disorientation. So that might be a good time for the sibling from afar to call and have a conversation, with your loved one, with your parent, to give you, the caregiver, an opportunity to just sit and drink some tea, whatever it may be that you need to drink, and your sibling can take care of the parent and have that conversation. Yeah.
Yeah, that's a great suggestion. Someone else mentioned how to specifically deal with someone with dementia who gets agitated when you don't agree with their delusions.
Yeah. So something we always recommend, if someone is experiencing a delusion or hallucination, you never ever ever want to argue with a person, because we have to remember that the delusion that we see them experiencing is their reality in that moment. And so you never want to argue with the person and say, that's not happening, or I don't know why you're being paranoid, like I'm here to help you. What you really want to do is help the person feel safe with you. So part of that is just listening to their experience of their delusion, of their hallucination, so that they feel like you care, like you're there to be a support. You're not there to take away their independence or take something away from them that could cause increased agitation. Because if you were to tell someone, what you're seeing is not real, that could be terrifying for somebody. So you really want to meet them where they are at. And just work through the delusion with them as best as you possibly can. And any moment that you can redirect the person to another activity, take those opportunities. So, let's say somebody is having a delusion that they are not at home, and they are at home. They're saying, I need to get out of here. I need to get home. Let me out of here. What you can do is you can say, I know that you are feeling really unsafe right now, and all I'm here to do right now is to help you. I want to help you feel safe. I hear that you want to go home. What are your favorite things when you go home? What are the things that you like to do? And just try to engage them in a conversation that is relevant to what they're experiencing in that moment. And at the same time, you can be walking around the house to give them that physical motion, that physical stimulation, and then also start showing them things around the house, maybe some reminiscent decorations that will help ground them and bring them back to the present, bring them back to where they truly are.
Mm-hmm. Yeah, I think that's great advice. Someone else also mentioned that what if the primary caregiver calls the person that they're caring for with dementia crazy? And
Mm.
how would you, as someone else in the family, respond to that?
That's really, really hard. I mean,
Yeah.
you never want to tell somebody, well, I'm doing this for you because you have dementia. You never want to do that either. And telling somebody they're crazy, I think it's like, okay, so you call mom crazy often. What is the goal in that? What are you trying to achieve when you call mom crazy? uh,
Mm-hmm.
and trying to kind of put that on the person as to what it is they're trying to get out of that moment. Is it so? Maybe it might just be they need a sense of relief, and that's the word that comes out. So, okay, what's something different that when you're feeling really frustrated with mom and you want to call her crazy? What's something else that you could do instead of doing that? Sometimes it might be walking away for 5 minutes, and then coming back. So, kind of helping to strategize with the person what they can do to replace that hurtful comment that they make. But you first really want to kind of share with, like, kind of explore with them where that's coming from and what they're trying to achieve in that moment.
Mm-hmm. Yeah. Definitely. Okay. And then I think we have time for one last question. I think this is a good question. Someone asking suggestions for someone waking up in the early morning, so like 3 or 4 a.m., and then awakening others. And then this person also asked if this is a form of sundowning.
Oh, gotcha. So yeah, so it could be so sundowning, it definitely can kind of go into the nighttime and cause nighttime wandering. I know some people don't like the term wandering, so you're getting lost, but basically, when somebody wakes up, and they may not be able to recognize whether it's day or night, and so this really, really disorienting and confusing for the person, and can cause anxiety as well. So it might be like a trigger for why the person is getting out of bed and walking around. So it's all connected though, because if somebody isn't getting enough sleep at night, that could increase the chances of them, experiencing sundowning later in the day, because sundowning can be caused by a lack of sleep. It can also be caused by a lack, too much exhaustion. So if somebody's doing too much in the day, but so a lot of this can come from, somebody just not getting enough sleep. So what you can try to do, if you know that the person does tend to get up, at different times in the day, at different times in the night, you might want to have certain things set up so that when they have woken up, whether it's like having like an alarm. There are alarms that you can get for the bed so that you can hear when somebody's getting out of the bed. And then sometimes you also want to, look at the home and figure out how you can create movement. Because if the person does have to get up to walk around to get that physical stimulation for whatever reason it may be, you at least want to be sure that the home environment is safe to move around. So, if there's a staircase, you want to be sure there's a gate by the stair, anything so that if they do wake up, you don't necessarily have to run out of bed to help the person back to bed. But it's, as I said, like so many of these things are like so much easier said than done. But what you really need to do is know the person. We have to know the person, because one intervention may work fabulously for somebody, not work for somebody else. It may work fabulously for somebody one week and doesn't work anymore the next week. So, we got to be flexible. This and yet again, so much easier said than done, but I think it's good for caregivers to recognize that there is that need for flexibility, because what worked one day isn't going to work the next day. But it's just trying different things and trying to stick with them too, because any behavioral modification intervention that you're going to use, sometimes it's not going to work for weeks, sometimes months even. You got to be consistent with it. So, just really trying to assess and try different things and have patience as best as possible.
Yeah, absolutely. I think that is such great advice. We're having some more questions coming in, but I do encourage you to utilize our helpline. Please give them a call. They can work one-on-one with you to really work through a lot of these questions that people are asking, and very importantly, come up with a game plan. When Jennifer was mentioning having that action plan and really, also coming up with roles, for these family meetings, our social workers here are wonderful and very well equipped to help you on that journey. So you can really get that personalized approach on how to best go about this. Jennifer, would you mind just going to the previous slide? Some people are asking for your contact information.
Sure.
And to the many people who are asking if you can view this later, yes, absolutely. This will be posted on our website under our Care Connections webinar. You can visit that at alzfdn.org. So you can view this at another time. You can send it to friends and family. So yes, thank you all so much. Again, please utilize our helpline for more of these personal questions. We'd love to help you out. And thank you so much, Jennifer, for this wonderful, incredibly informative presentation. I hope I can speak for the attendees saying that this was so wonderful. So thank you so much. Thank you
Yeah,
to,
and
sorry.
sorry. Oh, I just wanted to say thank you to everyone. And I just want to reiterate what Laurel was saying there, that if you were to call the helpline and talk with a licensed social worker, they'll be able to gather more information from you and help you kind of strategize what you've already tried, what you haven't tried yet, maybe trying a different technique, a different way. So, that's kind of the way that the licensed social workers can help, is to kind of, digging a little deeper in your questions and then really tailoring it to the needs of you and the person that you're supporting.
Absolutely, yes. That individualized approach that we're really hoping for is something that our social workers work very well on. So yes, absolutely. Oh, and for the person who is interested in seeing more of Jennifer, Jennifer actually does our professional trainings, which we have one coming up next week
Yes.
on the 19th, next Wednesday, the 20th, not the 19th, the 20th. So for people who want more of Jennifer, please check out our professional trainings that we offer to the public once a month. But thank you all again so much for coming. I appreciate everyone's questions and participation. And Care Connections is nothing without all of you. So thank you so much for being involved and wanting to hang out with AFA for an hour. We surely appreciate it. And just so you know, this is a very special month. We are actually having 2 Care Connections this month. So double AFA, which is great. So April is National Move More Month. So to celebrate this occasion, we're having a special editions Care Connection with Karen Peterson on April 28th, same time from 1 to 2 p.m. Eastern. She's going to be discussing the program that she created, Move with Balance, and showing us some exercises and really seeing how we can incorporate healthy aging activities for both our brain and our body. So you're not going to want to miss that. So once again, thank you, Jennifer. Thank you to all who attended. It's always a pleasure to see all of your names pop up on my screen. So thank you all so much, and I hope to see you on April 28th.
Thank you all so much.
Bye.
Bye.